And good morning and welcome. I am Dr. Peter Holmes, orthopedic surgeon and host of your program, Ask the Doctor. My guest this morning is Dr. Michael Gurl. Dr. Gurl is a gastroenterologist. If you have any questions for Dr. Gurl in the future, two ways to reach us. You can go through the web at www.needfoundation.org or fax 696-9012. Hope you all know what you have when you're on Medicare. Do you have a Medicare supplement, or have you replaced your Medicare plan with an HMO? It's surprising how many of my patients don't know this until they need medical care. Now, here's this thing. You pay for Medicare, into Medicare for all these years, 45 years, and you go to get it, and the government requires you to pay a certain percentage to see your doctor, i.e. 20% or so. Okay, so that's a supplemental cost. So you can buy coverage for that 20% cost. And that's what they mean by supplemental insurance on Medicare. So they have like plans A through J, A being the cheapest, which will cover usually the 20%, all the way down to J, which covers everything from walkers and canes to shoe orthotics, you name it, more expensive. On the other hand, they have this thing where all you have to really do is sign on the bottom line, and all of a sudden you no longer have a supplement. You have now joined a Medicare HMO, and you are no longer on Medicare. It's been replaced. And it's very easy to do this because all you have to sign it, and many of my patients don't know this is what's happened. So let me give you a recent case of a patient who was on a Medicare HMO, and they're not all like this, but just this patient didn't know she was on it. She fell at home, she hurt her hip, she got an ambulance, and she went to the hospital. She did not have approval to have x-rays of her hip, so she did not have x-rays of her hip. So they sent her home. Now her neighbor happens to be a caseworker for other things, and she was going over and checking on her. This woman's 90 years old. And indeed, this woman is in agony. She probably broke her hip. So she called 911 to get her transported back. They refused to transport her. They already transported her once, and she was sent home, and they have apparently the right to do that. So she was not seen again until the caseworker, who went ahead and called Austin and got things rolling. Then the patient was transported to the hospital, got her x-ray, and imagine, she had a hip fracture. Now see, if she was on regular Medicare, she'd have gone to the emergency room, gotten her x-rays, it's like fee-for-service, and been taken care of. But once you're on an HMO, you're under the rules of managed care. In other words, the managed care company, depending on their contract, gets paid up front by the government X amount of dollars. And if they were to spend money on x-rays or spend money on this or spend money on that, it comes out of their profit. And therefore there's a high pressure not to approve it until something really shakes and rocks and rolls. This is being pushed by the government. They want seniors in HMOs because it washes the government's hands of any fees that exceed what they would have paid to that HMO. It's all that problem. And they're probably going to want more of you in there. Instead of 20% that you may be responsible for, if they want more seniors in it, they may target 30%. Bottom line is this: you may want to be in a Medicare HMO, but you may want to just have supplemental insurance. You need to read the bottom line because you won't know until it happens. And then you're stuck asking permission from somebody else to get health care? These are my opinions. If you have any comments, two ways to reach me. Go through the foundation at www.needfoundation.org or fax 696-9012 to ask the doctor.
Clear vision begins with healthy eyes, and Medical Center Ophthalmology Associates is the largest group of eye specialists in San Antonio. They offer complete eye health services for the whole family. So, no matter how young you are or how young you feel, they've got you covered. From glasses and contacts or LASIK to macular degeneration and emergencies, they want to be your eye care specialist for life. Medical Center Ophthalmology Associates, specializing in your eyes, focusing on your needs.
Hi, I'm Danielle. I injured my knee back in February, but thanks to the foundation, I'll be playing again.
I'm Dr. Peter Holmes. The Orthopedic Need Foundation was formed to help those families who are underinsured or uninsured return their athlete to their sport. Please help us to return kids back to their sport after injuries like this.
You can send your donations online at www.needfoundations.org or call 210-542-1722. All donations are tax deductible. Make a difference in a child's life.